Hello all, the topic is going to be positron emission tomography, that is shortly called as PET. So first what we have to understand is we have already so many imaging modalities and why this PET is required. Okay, now why PET? As you know that already we have MRI and CT, and why we need the PET? So that is the question here. So MRI and CT are the devices that are used to image the structural things. Only structural imaging have been done with MRI and CT. But in positron emission tomography, apart from structural images, we can also identify the functional images, like different functions, like functions of a heart, functions of a brain, or functions of any artery or vein, anything. So with that, we can see the applications of PET. The PET application is majorly used for cancer evaluation, Alzheimer's, myocardial infarction, epilepsy evaluation, and coronary artery diseases. So while seeing the applications, we can understand that all these applications are related with functional imaging. So a functional image is required to evaluate cancer, Alzheimer's, myocardial infarction, epilepsy, or a coronary artery diseases. So now getting into the topic, PET, positron emission tomography. We'll look into the part of tomography. Tomography, as we know that it is an imaging technique where you're going to slice things and make it up in the final. Okay, now what is positron? So a positron, we get it from any kind of radioactive decay. What is a positron? A positron is a twin of an electron. The positron is an antiparticle of an electron and it has the same properties of an electron, but a positron is positively charged particle, whereas an electron is going to be an negatively charged particle. An electron having a positive unit electrical charge will be called as an positron. Now we're going to see what is positron decay. As we know, what is radioactive decay is decaying of radioactivity stage by stage. So we have different kinds of radioactive decay: alpha decay, beta decay, and gamma emissions. Likewise, positron decay is also an radioactive decay. Here, the only condition is going to be an atom which has a nucleus that is unstable. It means that a number of proton should be higher than the number of neutrons. The most important condition for positron decay to happen is the number of protons has to be higher than the number of neutrons. Now, what is positron emission? Positron emission is happening only because of positron decay. As we know, the only condition for positron decay is going to be whenever there is a more number of protons and lesser number of neutrons. So this atom has to get stable. So now the atom will try to get stable by emitting a proton. So now the atom, what it is going to do is, it is going to convert a proton into a neutron. An atom, to get stable, converts the excess amount of proton to neutron by emitting one positively charged element, and that positively charged element is called as positron. As we have mentioned two different examples of positron emission, one is gallium-68, which is having a half time of 68 minutes, and carbon-11, which is having a half time of 20 minutes. Like, these are the two different positron emitting elements we have been using continuously. We now see what is the biological things happening in PET. So we know glucose, C6, H12 and O6. This is a basic molecule, and what we are going to do is we just going to add a fluoride to this particular glucose. When adding a fluoride, this particular glucose will be converted into fluorodeoxyglucose, that is FDG. Here one hydroxyl atom is going to convert it into one hydroxyl atom is going to get relieved and one fluorine is added. The patient who requires an PET imaging is administered with FDG 18. Now the FDG18 is administered into the bloodstream and it almost spreads all over the body to each and every cell. Since the molecule is glucose, it can easily access the cell membrane and go into the cell. So there is a special opening for transport of glucose, that is GLUT 1, 2, 3. So through this GLUT port, the FDG molecule is going to enter into the cell. So here the FDG molecule is undergoing hexokinase and it converts itself into phosphatase. Now the glucose molecule in the FDG is going to get used and the fluoride radioisotope is only going to be in the cell. So now back to the physics. As the fluoride molecule is now settled inside the cell, is going to emit one positron. So now the positron is going to get emitted from the nucleus and it is going to get interacted with the electron that is placed nearby or around the cell. So this particular collision between an electron and a positron is going to result in annihilation. Annihilation is a process when a positron is going to collide with an electron. So when a positron collides with electrons, it emits two photons with equal energy in opposite directions. As we see in the image, you can see that this particular annihilation process leads to two different photons with an energy of 511 kilo electron volts on either side of the collision. This particular emission is then recorded with the PET camera. The PET camera will be having a number of detectors and that particular gamma ray emitted in two opposite directions is going to meet in the two opposite detectors. We are going to analyze two different situations. One is when the metabolic activity is high, the other one is when the metabolic activity is low. When the activity is high, the FDG intake on the cell is going to be high. When the FDG intake on the cell is going to be high, the amount of fluoride settled in the cell is going to be high. When the amount of settled fluoride is high, the gamma ray emission is going to be high. So when the metabolic activity is high, the emission of gamma ray is obviously going to be high. Situation 2. When the metabolic activity is low. As the metabolic activity is very low, the intake of FDG into the cell is going to be very low. So this particular intake will lead to lesser amount of glucose and lesser amount of emission of gamma rays. By this particular thing, we can understand that the emission of gamma ray depends upon the metabolic activity. A region with a higher metabolic activity will have a higher emission of gamma ray and a region with lower metabolic activity will have a lower emission of gamma ray. In the picture given at the side, you can notice that an arrow mark is pointing towards the brain where the metabolic activity is high, and another one arrow mark is pointing towards the lungs where the metabolic activity is low. The FDG is traced by positron emission tomography and it has different standardized uptake value. So to determine the different standardized uptake value, we are going to give a color code. If a standardized uptake value is high, the color is going to be in red. If the standardized uptake value, that is SUV, is low, the color is going to be blue. Anything that is in the middle will be in the green. So to identify the metabolic tumor volume based on the minimum SUV threshold, parts of the tumor may be inactive due to treatment or such effects as necrosis. The metabolically active region will be in the red color and the inactive region will be in the blue color. So then a tumor region is obviously going to be in the red color. So the total lesion glucose is a mean SUV throughout the MTV. It represents the average glycolysis activity of the tumor. The last image, we can see that metabolic heterogeneity. The metabolic heterogeneity is compared between the images. With this, we can easily identify the metabolically active region and metabolically inactive region. Though cancer is going to be a metabolically active region, we can easily understand the shape, structure and the metabolically highly active region of a cancer tissue. As seen in the image, there is a small tumor in the abdominal region. This particular white dot represents an abnormal activity, but this can be non-conclusive. You cannot conclude where is placed, what is the depth, is it placed in the kidney, is it placed in the abdomen, is it placed in the stomach. We don't know. So what we're going to do is we're just going to add a CT image. A CT image will be added with a PET image, and a new image that is called as PETCT will be derived. So from this image we can easily understand the topographical positioning of the particular cancer cell. So this is how a PT is functioning of an positron emission tomography, and with this particular technology we can understand and we can image all the metabolically active region in the human body. This is how a PET-CT is providing a functional imaging. As we discussed earlier, functional imaging is basics for cancer evaluation, Alzheimer's, myocardial infarction, epilepsy evaluation and coronary artery diseases. For such kind of videos in future, kindly like and subscribe. Thank you.